trip we've had 11 UQ students participating. Most of us are studying a Bachelor of Health Science.
The NCP study tour to Vietnam has been eye-opening, a transformative experience really. Under the guidance of Associate Professor Zhang and Dr. Stacey, we've gained invaluable insights into both public health practices and Vietnamese culture. For me, one of the most memorable aspects was learning to navigate the chaotic roads. What initially appeared as daunting almost became a metaphor in a way of cultural adaptation, to trust and move steadily and flow with the rhythm of local life. This experience taught me more about Vietnamese society than any textbook could. This trip has totally changed my outlook on how I see global health. Seeing how they run different health programs in a completely different culture really made me understand why we do need flexible health systems and how there isn't only just one answer to health problems and health practices. This experience has not only enriched my academic journey, but absolutely enriched my career. I think that it was such a genuinely invaluable experience, and everyone has been so welcoming, and it's genuinely just been life-changing.
I really enjoyed getting to witness the Vietnamese health system and getting to see it in a first-hand experience. So that was through field trips to both the National Lung Hospital and the commune health centres. I really enjoyed being able to see how the health system is so different from the Australian system, seeing the different ways that doctors practice. The National Lung Hospital was really interesting, getting to see how changes from what Australia can offer our patients, and the commune health centre was really interesting to be able to see how they have a varying style to a general practitioner, yet it works cohesively within their system.
Well, I believe the future of public health is moving global in nature with increasing impacts of climate change and international mobilisation. So I believe we as future public health professionals require skills and understanding of not only the challenges faced in different healthcare systems and countries, but also how to collaborate in a culturally inclusive and sensitive manner, which I believe has been a fundamental learning experience from this program and something myself and colleagues will take into our future practice.
It's hard to pick kind of just one experience. Everything has been so incredible, but as a whole, the people that we have met along the way have not only been so kind and open, but so welcoming in every aspect, whether it be our professors and their teaching or welcoming us into their homes. We've been lucky enough to visit homes here in the different districts outside of Hanoi, and the way that the locals have welcomed us has been unimaginably kind, and something that I will always take with me.
Definitely a really eye-opening perspective for those studying a Bachelor of Health Sciences. Coming from Australia and growing up rurally, I definitely thought I had a good grasp on understanding health inequities, but coming to Vietnam has definitely opened my perspective in understanding health inequities, especially in regards to climate change and how that can truly impact the quality of people's lives, and has definitely given me some direction for my future.
My favourite part of the trip to Vietnam was getting to experience a completely different culture and also being able to see how the health system operates. The unique challenges they face and the creative solutions they bring to their healthcare is really impactful and important as both a healthcare student and a healthcare worker. Comparing this to the health system in Australia has given me a unique perspective regarding health equity and public health.
This whole trip has been a new experience for me. I've travelled to other parts of Southeast Asia, but never Vietnam. This trip, the whole thing has been just completely eye-opening. From the culture, to the people, to the food, we've had just an amazing experience, especially being able to go to medical facilities and the Hanoi Medical University. That whole thing has been a completely amazing experience. So being able to go to Hanoi Medical University, be taught from professors who are tackling the problem of climate change in Vietnam currently, has been an amazing part of this experience. Being able to witness experts in their field talking about a whole range of climate change effects, and then we've actually been able to go out to sites that have been affected by climate change. I've also met some wonderful people through this trip who I hope to remain in contact with after this trip is finished. The whole experience has been completely amazing. It's been life-changing.
During our Vietnam trip, we got to work with the Hanoi Medical University by attending lectures and seminars on the topic of health and climate change. We then got to apply the knowledge learnt while visiting medical facilities such as the National Lung Hospital, vaccination clinics, and rural community medical clinics. We were then very lucky to meet other public health undergraduate students at the Hanoi Medical University, and we culturally exchanged food, we played some games, and we taught them the Australian nutbush.
I feel like these trips are valuable because it really gives us a whole new perspective beyond what we already know within the developed countries. We can build up those international ties and really get to know the world to be able to apply that to our future learning as well as our future careers.